Daniel, sir, can you please unmute yourself and speak once?
Hi, can you hear me?
Yeah. Suja ma'am, can you please speak once? Am I audible, Suja ma'am? Good afternoon, everyone, and I welcome you all to another session of Spare India COVID-19 Academy. Spare India COVID-19 Academy is a joint initiative of, it's a joint capacity building initiative of WHO, UNICEF, Ecce Foundation, and NITM. So the Academy today brings to you a panel discussion on the topic Children's Issue Changing Strategies in COVID Times, which is ECCE, Ensuring Infants' Well-being and Development. The undeserved communities are already facing many invisible costs of this pandemic. With dwindling to no incomes, closure of schools and ICDs, it's putting their children who are already undernourished at a risk of severe malnutrition. Also, with no learning opportunities, very limited parental capacity to facilitate the learning, the risk to children below 6 years is unique and it requires focused attention. So, without intervention, the health divide and learning gap for them is likely to widen. The speakers in this panel will bring out the varied dimension of vulnerability of this age group, what needs to be and worked upon during this time of crisis. To deliver the session, we have our first who is Miss Tara. She is individual consultant with MSc and PhD in food science and nutrition. She has spearheaded large-scale projects across the country. Being a member of many think tank committees working for women and children, she has also contributed for innovation, for institutionalizing new initiatives, and for strengthening the capacities of many stakeholders. She also has a number of publications for her credit and made valuable contributions in seminars and conferences.
Nabila, you're not audible.
Am I audible now?
Yeah.
We have another panelist, Sumitra Mishra. She's executive director. Uh, she has of Mobile Creeks. Sumitra has come over 20 years of work experience in the development sector. Her direct work experience is with decentralized and has been the pivot of strategic programming, fundraising, organizational development, and policy influence abilities. Welcome to the session, ma'am. We have another panelist with us, Suja Warrior. She is CSR Infosys Limited. She has over 2 decades of experience in corporate functions and community intervention. She has taken sabbatical for 2 years to work with tribal community in Bodland near Indo-Bhutan border in the states of Assam. She also worked on the ground level for relief and rehabilitation of tsunami, Uttarakhand flood, and other Bodland violence. She advocates sustainability and CSR through her lectures at universities, including IITs and VHU. Welcome, ma'am, to the discussion. We have Aprajita Bharga. She is early childhood and development specialist at UNICEF. Aprajita has a master's in child development and education with specialization in early childhood care and education. She has about 13 years of experience of working in the area of early childhood education and development. Welcome, Aprajita, to the session. We have Mr. Jacob Daniel, Strategic Lead Child Health and Nutrition, World Vision India. He has more than 20 years of experience in development sector. He has an educational background with masters in public health and public health nutrition. Mr. Daniel started his career working in grassroots NGOs and has led the programs with several national and international NGOs. Welcome, sir. We have Dr. Ilya Zafar, advisor program Sphere India. She has more than 17 years of experience in humanitarian and development sector, including many international missions. She has also authored several academic papers on disaster management and gender in emergencies with a focus on women and children. She has worked with CARE International Federation of Red Cross, Red Crescent Societies, South Asian Indian Delegation, and UNDP. She's currently also serving as Chief of Program at Save Life Foundation. Welcome, Ilya. And we have moderator for the session, Satyashri Goswami. She is Director Development Support CRI. Satyashri comes with 22 years of experience in the gender and child rights domain. She has several grant and legislative policy projects at national level, which has been successfully implemented across multiple states in India. Currently, she is also pursuing her PhD from Tata Institute of Social Science, and previous to this, she has worked as Director of Programs at National Foundation of India. Welcome, Satyashri. And with this, I welcome all the speakers and moderator, and I hand it over to you, Satyashri, for taking forward the discussion. Satyashri, unmute yourself, please. You're muted.
Thank you so much, Navila. This is on behalf of CRI. I would like to thank Sphere and all the esteemed speakers for joining us today, along with people from across India. Children of the age group that we're going to talk about have been invisible, and those of us who are, working with children, we know that. At CRI, I think one of the first things that we thought about was that how do we keep children engaged at that age group? So we have about 30,000 children. We have provided play material and apart from supplementary nutrition that we do and the regular work. So this list of speakers, we have 6 speakers today, and then it'll be followed by question answers, and each speaker would speak for about 6 to 7 minutes. And it's a wide range of experience that we have today in this panel. And without much ado, I think I'd like to start with our first speaker, Dr. Tara. Dr. Tara, I think...
Satyashri, sorry to interrupt, but there's some technical glitch. She has not been able to join yet.
Okay.
I'm still tracing her, so...
All right. Shall we go ahead?
We shall go ahead.
Yeah.
I think we can go ahead with Mr. Daniel as soon as she joins.
Right. Okay, so Mr. Daniel, I hope you're there. And I think once I invite you, I'll switch off my camera because that might help. Mr. Daniel, I think you have worked with children's nutrition and nutritional needs across India, and you might want to, help us understand what the current situation is as you foresee in your experience, and also a little bit of, putting it into the context of emergencies. Although I understand this pandemic is not like other emergencies probably that we have seen in our lifetime or in our while we are doing our work. So yes, Mr. Daniel, can we listen to you now?
Yeah, thank you, Dr. Satyashri, for that introduction and all. And we would like to thank Sphere India for giving me the opportunity to be with these distinguished panel members. And I'm representing World Vision India. So I would like to share my screen. One second. Yeah, I think you can see my screen.
Yes, we can. Yes.
Yeah. Okay. So as I told you, we are World Vision India is working pan India, and we are working with different sectors. But right now, I'm representing the nutrition sector, which we are working, and we have several projects across India, and we have changed our strategies to accommodate the as a COVID response. So I would like to highlight few of it in this one. So, but we are having a specific strategy for a COVID response in our program area later. But what was our immediate response during in the nutrition aspect for the infants? So I'll just explain it here. So here, if you can see, it's the malnutrition is a circle. So if you see a stunted girl or undernourished girl can become a stunted or undernourished woman, and that woman can become a mother who is always also an undernourished one. So that may result in an infant who is undernourished. So it's a circle. If we want to change that circle, so we need to intervene at every point of time. So it's government also taken a life cycle approach. So but if you see, in this life cycle, the infant period is the most critical point of time. So we call it as window of opportunity, which is called as the first 1000 days. So you can see, and I'll tell you what is first 1000 days. That is from the pregnancy to 2 years. I think most of our other listeners may be knowing about it, but I'm just telling that, in the first 1000 days, the inputs, nutrition, health, or care, whatever it is, that shapes the child's future life. So any interference during that particular point of time has a long lasting effect. So maybe it may be due to kind of any kind of disaster, or issues in the family, issues in the community, anything can affect that child's life in this 1000 days. So what world vision is doing, we are concentrating on a positive behavior change in the community of these children. And we are mainly we are adopting a strategy of timed and targeted communication, where we uh, uh, we have messages which is not too late or not too early for the mothers or pregnant women. And we also have a peer group method called care group approach. So this is right now focused on the positive behavior change. And we have nutrition garden and backyard poultry. See, that dietary diversity is very important for an infant. It is a part of IYCF. So we have initiated nutrition gardens and backyard poultry to pregnant women and the families. And we support families in getting safe drinking water, hygiene, sanitation aspect in both households and the community as well. So, and we are looking at the acute malnourished children, early identification and referrals of them. And VHND services, that is a basic service in the village. So we have a set of volunteers who are supporting us in the villages, who can mobilize these women into VHSND services. And we also sensitize community as a whole in different aspects. So this is currently what we are doing in the nutrition sector. So as because the COVID came, like you can see, I mean, a lot of changes are there. So there is a lot of uncertainty in the community. And that is one of the main problems. See, what is going to happen, that is there. And issues related to livelihood, issues related to migration, all these things have affected the community. So there will be a lot of changes. So we also have to adjust ourselves. So these things, how we can, we have suddenly changed a little tweaking in our strategy, so that we can reach to the community. I'll just explain that thing. So we have made our volunteers trained to reach these pregnant and mothers of children under 5 through their mobile phones, or through phone connection, uh, so that the essential information can be communicated to those women. So we are encouraging them to get timely health checkups done. Sometimes VHSND may not be functioning in the village. So in that case, they can go to the nearest health facility. So those kind of information in a timely basis we are providing to the beneficiaries in our village. So, and second thing, COVID related messages also, how to prevent COVID infection, social distancing, mask, all those things, hand washing, all those things are also sensitized in the community through telecounseling, till we were able to reach the community. And we have, there are food crisis in the community. So this is one of the area which we have to address, because if there is a food crisis, it is going to adversely affect the child's health. So even in the pregnant woman also. So we have extended a food basket to all our community members. And surprisingly, our nutrition garden, I mean kitchen garden or backyard poultry, really was helpful in this point of time, because we have made the families to combat this type of situation, because they got sufficient vegetables and fruits, and even egg also during this crisis situation. They need not go outside to get such things. So essential dietary diversities are maintained during that point of time. So, and another thing, like, our volunteers as well as our team in ground. See, we are one of the largest implementing agency in India. So our team staff also like supported the families to get the birth preparedness. So I mean, there is an issue of transport, and sometimes people may not know, like, which hospital is going to do the delivery services. So those information, like, we collect and we pass it on to the families who are totally remote and help them to prepare for their upcoming stuff, so that they can reach
Mr.
out
Daniel, you
to
have two
this. Yeah.
minutes more. Yeah.
Yeah. So, like, and we also use BCC materials, videos, and all, which is provided, which is developed by different agencies in our communication. So I'm just stopping. Like, I just want to share a few pictures, like, which we are doing, so you can see communication with social distancing, few things in nutrition garden, and food basket distribution, those aspects. So yeah, that's all from my end. Like, I think the question answer will be the last, right?
Yeah.
Thank you so
Yes.
much for this, Satish.
Yeah.
Thank you. Bye.
Thank you. Thank you, Mr. Daniel. And yes, Kitchen Garden, those organizations, including CRY, who promoted Kitchen Garden amongst community, that it would come to use so much during this pandemic time is an eye opener and quite a insightful understanding. So thank you for that. I think one understanding that we all have is that marginalization of children, especially the age group that we are focusing on now, has really increased. And therefore, I would request Sumitra from Mobile Crashers to help us understand, there is this talk and ringtone of unlockdown. What this unlockdown might do, in terms of the creches or the other centers that we have for children, and, for resource poor community, what that would mean. So, Sumitra, I invite you to take the stage.
Thank you, Satyashri, and thanks to Sphere India and the entire COVID Academy online platform team here. Thanks to Cry for giving me this opportunity to share about the really young babies and toddlers that we are talking here today. I was meant to go after Dr. Tara, so I didn't focus too much on the immediate impact on children's health and nutrition, thinking that Dr. Tara would have covered that. But anyway, we hope that she comes back to the session and she's able to share her bit. But just to start with, in terms of what is the immediate impact on children, even before the unlockdown, how does the immediate impact during the lockdown, how is that effect carrying over during now as the world is opening up gradually, and subsequently over the next 2 to 5 years, how this is going to impact the very young growing children. We know that it's now common knowledge that health and nutrition has been more severely affected. Umi also mentioned a little bit about how, as World Vision India, they have been tracking and supporting CRY, and many of us, as our immediate emergency relief response, first looked at the survival needs of entire families and young children in terms of providing nutrition and health support. We also know that the whole health and immunization system has broken down during the lockdown period, and it continues to remain halted and fragmented even as the world is opening up. What I want to focus on is also the emotional health of children during this period. Obviously, families have undergone huge amounts of trauma and stress, and that has led to an impact of this kind of trauma and stress on very young children within the first 3 years of age, or as the first 1,000 days that Umi mentioned. Now, I mean, we know that sustained exposure to this kind of stress leads to toxic stress amongst children at that age, and this will have lifelong outcomes when children grow and go to school and in their adult lives. At a period when, according to the Harvard Center for Developing Child, says that 1 million neural connections are formed every second in a child's life, imagine what this pandemic has meant for the breakdown of such synaptic connections and what it would have meant for the psychosocial development of children and therefore its impact on mental health. Something for us to remember as early childhood development policy planners and practitioners and service providers, that this is a big aspect of work that is going to remain become a critical focus as we move forward. Uh, Besides health and nutrition, both physical nutrition and the physical health and their emotional health, we also know that the first 1,000 days is when more than 80% of children's brains develop. Learning is at its most rapid period. But who is talking about learning, infant stimulation, and early education for the really young babies and children when the world is undergoing such major crises? Of course, there is a lot of talking about school education and even to an extent ECCE education being provided through digital and online means without going into the merits of the plus and minus of online education for such young children. The point that I want to make is that who is really thinking about children's infant stimulation and learning during the lockdown and post lockdown period? Who is providing the services, and who like us are demanding attention to these services, things that we must be mindful about, because a child just doesn't need food, it needs someone to feed the child, it needs the caregivers love and attention during this period, and we know caregivers are under extreme stress. It needs a whole integrated approach of health, nutrition, care, early learning and protection. And we can see that there is a complete breakdown in this holistic approach that we've all been practicing as a part of the nurturing care framework that the WHO and UNICEF guidelines also keep re-emphasizing on. But it's not just the impact on children. Now, we all know that young children are particularly dependent on their caregivers. So, how has this ecosystem or this pandemic situation really affected, and what are the things that are affecting? Satish, you mentioned about the unlockdown phase. How does the unlockdown really now impact children as we've seen moving from the lockdown phase? First of all, I think we are all mindful about the huge humanitarian crisis that has been caused due to the reverse migration of migrant workers returning back to their homes and villages, which means children are going through a very dangerous journey back to their villages. The biggest risk over there is children are already fragmented from the urban systems. They all were already were fragmented. They are further separated from the urban systems. They are reaching villages in large numbers. It's putting stress on the rural infrastructure, something that all of us must be mindful about, that young children do not slip through the systems, do not fall through the cracks, and there has to be a robust system to track, identify, and record such returning young children and respond to their immediate needs. That's one thing about the reverse migration and how it is affecting. The second thing in this unlockdown phase is the whole idea of opening economies. Now, opening economies is critical as the nation moves forward, which also means that these poor migrant workers must get back to work and claim their incomes in order to sustain and survive. But as families, particularly as working mothers, begin to work, and we are talking about working mothers in the unorganized sector, as they are beginning to work, what does it mean for the care and protection of young children? There are two aspects that we must consider. First,
Sumitra, you have 1 minute left.
oh,
Yeah,
okay.
yeah.
So, as women are moving forward, what is the care that going to happen for children? And the larger impact, of course, is on the whole point of people being pushed into poverty and debts, and that means far lesser resources to be available to families to provide for the young children. In my 1 minute, I'll try and go through quickly some of the action points in terms of as a group what we must take care. Of course, I did mention about the health, nutrition, immunization systems for ICDS services to restart, at least for the growth monitoring, immunization, and nutrition services, and for the nutrition counseling centers if they are closed, and to provide the severe and acute malnutrition children and the anemic mothers at home support for nutrition. Second, the whole idea of responsive parenting. I know Aparajita is here on the panel and she'll talk a lot more about responsive parenting. But infant stimulation and early learning is not just about the young children, because parents are now moving from becoming care providers to ECCE educators. So there's a big responsibility to support parents through their emotional and physical stress as to how they can provide responsive parenting and early education support to their children. The third thing I want to focus is on the aspect of equity and inclusion. This is also the time that the extremely poor, the marginalized, the minority, the children with disabilities, girl children can also get further invisibilized within these young children. So we as civil society and in our negotiations and dialogues with the government have a much bigger responsibility to keep our track on the equity and inclusion, that we do not miss these children, because they also and their families need the attention. The fourth thing that I want to say, and I'll quickly finish Satyashri here, is that all of this also depends on our frontline workers. It is the ICDS workers, it's our creche workers, all the people that we have are community mobilizers who themselves come from pretty under resourced communities themselves. So our frontline workers need our support, capacity building, physical emotional stress, security of their jobs and their incomes, and that's an important piece for us also to consider as decision makers and practitioners. Fifth, and the important point that you made, as creches are opening or as economy is opening, but creches continue to remain closed, there is this big issue about how do we provide care and protection. There's a whole focus of government on Manrega. Manrega mandates for creches under the Manrega Act for women workers. There is possibility to employ women job card holders with little bit of training for them to also work as creche workers and provide support with the safety guidelines for children of women who are employed under the Manrega work, and so also as construction workers and all the places where creches are mandated under law. If these industries are opening, it's important for us to dialogue with those employers that they must also make alternate arrangements for creches and daycares for the children of their workers. Finally, and I'll stop here, is to visibilize the issue. You, Satyashri, mentioned that they continue to remain an invisible population. This is a pandemic of disproportionate proportions, and therefore, children will always remain a slower priority for the government, but children are not going to wait for the future. Their growth needs to be met today, their survival needs to be met today. We need far more voices to be talking about it. It seems that we are talking a lot about it in the webinars, but is it leading to action on the ground? Therefore, supporting frontline organizations to deliver these actions on the ground is also as important as taking these voices to the policymakers to make a child sensitive and a child friendly emergency response planning and a post pandemic unlockdown planning also. Thank you. I have lots of experiences of what mobile crashes has done in all of these aspects over the last 3 months. But if there is time during the question answers, I can share the mobile crash bit. But I think this
Right,
is important for all of us to consider. Thank you so much.
right. Thank you, Sumitra. I think you really put these action points together, and it'll help us as development workers to, at our own levels, be at the advocacy or at the ground level, to do a lot of work. And I'm glad that we are now, our next speaker would be Miss Suja, who I'd invite to share about her experience and expertise with the childcare facilities and the relevance and effectiveness, especially in this time. So thank you so much, Sumitra. Over to you, Suja. Uh,
Hello, can you hear
yes.
me?
Yes, Suja, we can hear you.
Okay, fine.
Thank you.
Thank you so much for inviting me for this webinar. And I heard Sumitra was speaking whatever was in my mind. I felt like most of the points she already covered. As an employee of Infosys, maybe I can say that I have the corporate experience with a little bit of community living or community experience in some of the border places in India. With that, both the like if I look at both the lifestyle, I can see that the children are always children and the most the valuable assets we all have. And but when it comes to their lifestyle or the learning part, there is a huge divide actually. So the children which they from the corporate sector, maybe the sectors which I belong to, are having highly like more privilege than any other children in our country. And they have various options when it comes to a childcare facility. And we also have options available in case of an employee working in a corporate sector. We have some in, especially in the IT sector, we have something called a return to work after maternity. We provide all the support for the mothers to take care of their children while they are in the workplace. And we have different types of childcare facilities provided for the employees, like the high-end one, which is live streaming for the parents to watch what the children are doing during daytime. Also, there are creches or the facilities which are near locations, near their place, or maybe some support system inside the campus kind of thing. But if I look at the situation now, all of them are in kind of a stress now. Even the parents and the childcare providers and the staff in that organizations are really going through a tough time, because the children, most of the children are confined to the small houses or flats. If I can accommodate, or I can maybe what I say, if I have the enough resources, maybe I can have a good house in a good layout or a good apartment complexes with all the facility. Even then, they are basically confined to the walls of inside the room or house because of the scare around, and the number of COVID cases are increasing around. But when it comes to a child in the village community, maybe 13.44 lakhs or something is the number which Anganwadis are talking about, the number in India. But when it comes to them, I'm not sure whether those Anganwadi started functioning, because it has to function. Then only the parents can go for work. And if the parents are taking the children, not putting them in the Anganwadi and going to the workplace with the children, it will actually stop all our work in this space for so many years, because we are trying to get the children back to the school, or the dropout rate, reduction of dropout rate and all that we are talking. But when it comes to these kind of situations, if the parents are taking the children to the workplace, then it's again a failure from our side. Everything is system will collapse. But when it comes to the city children, they are kind of not having enough contacts, and a child care was actually providing them the opportunity to interact with other children, group learning, sharing, caring, and the feel and touch of other trained professionals in the childcare facilities. But and if you look at the childcare providers in, especially in the city and connected with the corporates, they are all actually kind of what do I say? They are all professional, trained, and they also learn the way how to run a professional organizations or a childcare center with all the legal papers or legality around it. And they also registered under the government Shops and Establishment Act and all that. And everybody's the trained professionals are working. So it is actually an early childhood learning for the children, and the founding years are actually good for them when it comes to a childcare facility, rather sitting at home with a maid or somebody who is not able to intellectually help them to develop. And also most of the childcare providers are actually giving them good material for learning. But now most of them are providing online courses or e-learning materials or mobile or computers or TV, but that is not sufficient. A child needs touch, and also the care providers are actually taking care of the nutrition aspect of the children, because that is one of the mandated requirement for a childcare provider if at all they are connected to an organization. So these are all actually affecting. And I am worried about some of the children who have traveled maybe kilometers with the parents in the most struggled time. I don't know how they will, it will affect at some point of time in their life. These are all struggle which the childhood is going through now. And most of the places in the city, they don't even have a place to play. They are always inside the house with a maid or a parent. and the parents are also working. They don't have the time to look after them or encourage them or engage them with something. So these are all, I think, a struggle. And as I said, as a parent, I also, as a single parent, if you look at a single parent, it's more struggle and more work nowadays when you work from home. And now most of the companies are also talking about moving most of the people to work from home option. So basically, I can say that hundreds of childcare providers are shutting down their doors, saying that that's no business. But at the end of the day, it's a function. It has to work. Whether the facility may change from one place to other, maybe moving from a building in an office to a community level or an apartment complex to help the children. But the children need socializing, children needs outside play, children needs engaging with other children, sharing, caring, and all these things our children needs. And this is a tough time for them, even though we are trying to help them in whatever way possible. I think that's fine from my side. That's the points I wanted to make it here. I'll come back.
Thank you.
Thank
Thank you so much. And I think you have, which also Sumitra touched upon, that for these young children using gadgets, you know, what does it do? We didn't even have the time to evaluate. We didn't even have the time to think through, or how much our parents, in touch with the reality. And we have, it's a, though people say it's a new normal, I think we need to re-look at what we are calling the new normal. And thank you for pointing out, Suja, what it is for all parents with children who are really tiny. Thank you so much. I think we have Dr. Tara with us now. And I would request Dr. Tara, to really let her talk about nutrition. And we are all looking forward to you, mothers and children, and what this pandemic is doing, and what do we see that is coming in the future. Over to you, Dr. Tara.
Yeah. Thank you. Am I audible?
Yes,
Hello?
yes, you are.
Yeah.
Yes, you are audible.
I've already sent the my PPT. If you can present it, it's fine. Otherwise, I'll go ahead with it. Okay. Hello.
Yeah. Do you want me to
Yeah.
share the screen?
Yeah. If you can do it, it's good. If you can, please.
Okay, sure.
First of all, I'd like to thank all the organizers and the panelists for, allowing me to share my experience. I'm going to speak on well-being of women and children at the time of COVID-19. Basically, most of the information has already been given by the other two panelists in terms of child-related issues. However, my focus will be on essential nutrition services delivery for women and children, because it is very, very crucial. And we see today that the extent of hunger and malnutrition is such a, such a big challenge for the entire country to kind of, work towards its eradication. So having said that, my focus of my presentation will be on just the prevailing malnutrition scenario in the country, and then food and nutrition insecurity that we have today, and what are the imposed risks due to COVID-19, and need for continuity of services, especially child wasting, because this is the most important thing, wasting of children in terms of, because it's an lack of food that makes a child go through several problems. And in this scenario, we've seen that child wasting needs immediate attention to mitigate, and how it has to be managed. Then ensuring effective infant and young child feeding practices, maternal nutrition services, nutrition supplementation, and healthy diet for all during COVID-19. So this is going to be broad areas of my presentation. Next, please. Having said that, I'd like to say that, why nutrition is important at this juncture. Okay, we all know we've been taking food. Some of us, do it, take just as a, like any other thing, not giving attention to why we are eating and how we are eating and why we should eat and why we should not eat certain things. But COVID-19, if you look at, enhance the risk of infection and malnutrition, and therefore timely action can mitigate risk and protect children's abilities to grow and thrive well, particularly when nutrition, is given due attention. as nutrition protects children's development and contributes to a strong immune system and allows slows the spread of the infection, the disease. Children, that is pandemic that I'm talking about. Children without family care and with disabilities are more likely to be undernourished. I'm sure all of you are aware of it. And children, undernourished children are 9 times more likely to die from infectious disease. Poor nutrition in early childhood can cause irreversible delays, and nearly 45% of all child deaths are related to undernutrition. And particularly during such situation when there is lack of food, the situation can aggravate. Crucial part of nurturing care in early childhood, nutrition plays a very important role and therefore makes more resilient. And also it's in a way, it creates some kind of a buffer for health and socio-economic, socio-emotional effect during crisis. Then also quality of early childhood development intervention can gain 30% return on investment and annually, which improves the health outcomes, productivity, and earning capacity. Therefore, any disruption in food system escalates food insecurity, particularly for the most vulnerable.
Tara ma'am, we lost your voice.
Yeah, the last.
Yeah. We can't hear you. Dr. Tara, we can't hear you. Can the others hear her?
No, I can't either. Dr. Tara, are you there? She's there, but not audible.
Yes, there is no voice. Yes, we know that we can't hear her. I think she was...
I think she dropped out.
Okay. She was bringing out a lot of important point through her presentation on what the importance and significance of ECD interventions. So let's hope we'll get her back in some time, and maybe Navila, try to get in touch with her. We will go ahead with the next speaker.
Sure. I will try to be in touch with her. You can take forward here.
Yeah, it's very unfortunate. Somehow nutrition is evading us, kind of. Okay. Our next speaker is Brajita. And like it was mentioned earlier that, though we are speaking about children, we also need to understand about the other stakeholders, especially the parents or the caregivers and significant others. And so I think I'd invite Aparajita to throw light on how do we, bring in the parents and the caregivers, and how do we enhance their knowledge and give maybe some capacities and capabilities in these challenging times. Aparajita, over to you.
Good afternoon, everybody. Thank you so much, Sphere India team and COVID Academy partners for this opportunity. And thank you, Satyashri, for inviting me for this presentation. I'll try and share my screen. Can you see my screen?
Yes.
Yes, we can see your screen. Yeah.
Okay, thank you so much. So I'll be talking about the nurturing care for young child, and Most of this is maybe a repeat for you, because Sumitra has already spoken about all these aspects, but I'll briefly touch upon that and then go on to the responsive parenting piece, which she also wanted me to focus on, and I will. Early years, very important. Brain development happens, 90% of the brain development happens by 6 years. Synaptic connections and the human brain development, the most sensitive and the critical period is during the early years, first three years of life. The synaptic connections that are formed in the brain are dependent on what are the experiences of the children, and in the current times when the experiences are so stressful, um, uh, we don't know what's actually going to be the impact of this, and we have to we'll wait and see what is the impact of these tense times on our children. I'm going to focus on the nurturing care framework, which Sumitra did talk about, and I would focus a lot on that. And because we're talking about nutrition, we need to talk about health at the same point of time. We need to talk about responsive caregiving. What is stimulation? What is when the child is picked by the parent or by the mother while she's feeding? What is it when the hunger cues, safety, security, opportunities for early learning? So these, we have to see child care or child development into a very comprehensive manner, focusing on all the different aspects or components of nurturing care. Here we need to see the components that there is a service delivery piece, and we have to talk about that, and we have to talk about quality within health services, nutrition, protection, early learning services, and equitable access for all children, in order for them to develop to their highest potential. But it's also the other piece, which is the parent or the caregiver. The caregiver who are there in the services, who are providing these services, as well as the caregiver at home. So the caregiver at home also needs to be supported in understanding what is nurturing care, what is this care, what is positive parenting, and how to provide that kind of parenting or early learning opportunities to children at home. This is all from the WHO UNICEF nurturing care framework, and how do you provide nurturing care? So at the core is the caregiver capabilities, but at the outside level, it's the policies, the enabling policies that we have. We have certain policies which are supportive of child development. We have the ICDS, the Integrated Child Development Service. We have this crash scheme. We have the HPYC, the home-based care for the young child. So, and supportive services, which are Anganwadi centers, ashas, home visits, and then this community which needs to be empowered, and the caregiver's capacity needs to be built. So till the time the caregiver is aware or capable to utilize these services will not make any sense. So we need to work at all these 4 levels. In the current context, when the policies are there, the services are there, but they're not functional. They're not fully functional to the level that we would like them to be functional. Parents have become the frontline respondents for all the needs of children, and hence working with parents and the families have become very crucial. So in this context, if one sees, how do these parents or these children feeling? What is the feeling like in the home environment? One realizes that there's a lot of emotional stress. This is some data that I could find out, and it says that more than 40% of children are under emotional stress, and this is data from adults as well as children. So there is stress, and while there is stress, and the stress is for different reasons. It is the stress of just being restricted to a to a home environment, stress of not being able to move out, stress of losing a job, stress of not having a livelihood, not going back, reverse migration. There are different reasons for these stress, but there is an opportunity as well, and if we capitalize on that opportunity of engaging with parents, engaging with them to engage with productively and positively with their children, with their young ones, can some can be beneficial for both. It is beneficial for the child because the child's going to be learning. It's benefit. The child is going to have a stronger bond of attachment with the parents and the family, and also for the parent to be less stressful about the economic and social crisis that's happening around. So this confinement to home with the with the restricted work outside, with the school closure, the preschool closed down, it has given us some opportunities where we can explore if the relationship between parents and children. Most of the parents in this context have been working, whether it is in the formal sector or in the informal sector, and they have not been spending as much time with the children. Being a mother myself, I have not spent as much time with my 4-year-old son as much I've spent in the last 3 months. And there are similar stories, and with all stratas of the society where we are forced to be spending more time with children, and it can be put into an opportunity. So what is responsive parenting, or what is that parenting that we want, or the positive environment that we want for our children? It's very important for their early experiences, to have a nurturing care. So
Rajita, you have about 2 minutes more.
Sure.
Yeah, thank you.
So responsive parenting, we talk about interaction with the children, we talk about behaviors, we talk about emotions, knowledge, beliefs, attitudes, and practice. All this combined together becomes the responsive parenting piece which we would like to focus on. How can we reach to the parents? Because if we understand all the complexities and reaching out to the parents right now. What is needed is that we reach out with the right kind of information, the appropriate knowledge to these parents who are under stress. Agreed. And there are 2 ways of doing it. One is existing platforms and opportunities, because some of the essential services have started to open. There is distribution of take-home rations. Some states have started a little bit of growth monitoring, home visits by the ASHA. Limited, but there. The parents have the mother and the child protection card, which has a lot of information about what the parents could do with children. On parenting tips are provided in the mother and child protection cards. Then we are also trying, and many other organizations are trying to reach out to the parents through different media platforms, whether it's electronic media, TV, radio, print media, digital media, community radios are being used to reach out to parents with the right kind of messaging. And I will leave the audience with, I hope this is going to be available with the participants. There's some resources which have been developed, and I've just put all the links of these resources in the 2 slides. Thank you so much.
Thank you, Aparajita. Thank you, Aparajita. Thank you so much. We have not yet been able to, reach out to Dr. Tara. So I think it is really important. And as you were talking, Aparajita, what reminded me is that it is also so important, as in CRY, we look at this holistic, when we look at the child rights approach, of how does a young mother who's married off so early, many a times, do a responsive parenting when she's herself a child? So that's a question that just stayed with me as I was listening to you. And probably these are larger developmental questions that we'll ask, and therefore how important it is to look at the child holistically and across the development cycle. I now invite Elia to speak about and share with us how multi-sectoral approaches, especially from understanding of emergencies and the standards that we need to look at while addressing an emergency. And I'm sure for Sphere Academy, where she belongs, it has not been easy with this kind of pandemic, which is like, a disaster probably not yet under control. So Ilya, I really invite you to help us understand the multi-sectoral approach and what the standards that one could imagine and think of. Yeah, over to you, Ilya. Hello.
Ilya, are you there?
Can you hear me?
Yeah.
Yes.
Okay. So thanks, Atishri. I would like to start with a recent report from UNICEF, I think 2 days back, which mentioned that around 120 million children in South Asia are likely to slip in poverty over the next 6 months. So we already have a situation where due to COVID, people are already worried. They are trying to find means of how to work in communities, what kind of interventions to design. But going forward, there is also going to be poverty, and we will have to adjust our programming, thinking and considering that. When the poverty is increased and resources would be lesser, it will mean less access to resources, not just to food and nutrition, but across the services. So, when I say multi-sectoral, our previous panelists have already spoken about the need for intervention in terms of nutrition, and why this is so important in early years. Also, to some extent, we have touched upon child protection issues, although I'd like to talk a bit more about it. For example, we know from Ebola crisis and also from the pandemics in the past that young children are more likely to experience abuse and neglect in their families. And also in COVID lockdown, if you remember, there were news reports of 50% increase in the incidence of abuse, and therefore there were calls of protection from abuse. So there are issues around child protection that needs to be looked at. There are needs in continuity of health services. For example, immunization needs to continue. There has to be prevention and treatment of the causes of childhood illness. There is a need for continuity of maternal health. So, and also newborn care. There is a need for intervention in health sector. There's a need for nutrition sector. There's a need for child protection. There's also need for wash sector, not just about hand wash practices and good hygiene, but also if we are talking of Anganwadi centers and all, in terms of unlockdown, when children start going to such centers where the ECC is being provided, there will be a need to look at physical distancing in terms of the structure, the shelter aspects of it. Also in terms of the water points or the toilets, there will be a kind of looking at the wash aspects, the shelter aspects, the health aspects, the nutrition aspects, the protection aspects. So this is not one sector that we are talking of. If we are talking about early childhood development, we have to work in an integrated manner through a multi-sectoral approach. All the actors working across sectors have to come together to come up with a strategy and a plan to respond to such crisis and to ensure that ECD and ECE services continue. Having said that, I would also like to mention that there are some standards, some quality standards exist for early childhood development and also for ECCE, also ECD in emergencies. And some of the standards, for example, are sphere standards. We have standards of WHO, UNICEF care for child development, we have INE standards, which is Interagency Network for Education in Emergencies. We also have INE guidance notes. So there are things which exist. And in COVID, the situation has become even more complex. So we have to look at how to meet the standards, also understanding the complexities of the situation. The usual ways of approaching may not work in this case. So there is a need for people to come together. Now, there is also something called a Child Protection Working Group, which is a subgroup of a global protection cluster. In India, we don't have cluster systems, but Sphere India works through sector committees. And sector committees exist for education, health, protection. So all the sectors that I mentioned, there are sector committees within Sphere India, which have been formed, comprising of all the NGOs and INGOs, like all of the list, all those in the audience and listeners. So people come together, those who are working per sector, they discuss in terms of what is the situation, starting with the situation analysis, doing assessments, analyzing the situation, and coming up with a plan and a strategy. So that is something which is very important, which Sphere India is providing a platform to do such coordination, bringing actors together, and that's happening. And also in terms of adapting the global standards, the global guidelines, the global policy document. So Sphere India is also in a process of adapting it in the form of a Indian handbook, which has components of each sector. And we already have the protection sector, education sector, health sector authors writing the handbook, and very soon that draft will be launched and tested. So this is, again, I would like to invite the audience and also interested here to be a part of the process. But I think it's very, very important for all actors to work together to see it as not in silos, but seeing it as an issue as one child needing everything. It can't be that at one home we are giving only the health services, in another home it's just the nutrition services. One child has all the services, and holistically the planning has to be done to provide all the services in one go, meeting the standards that are required for any life with dignity. So with this, I would like to close and hand over to you, Satyashri.
Thank you. That was very comprehensive, Ilya. But I have one little thing, if you can add that. Has this pandemic changed any of the sphere standards as such? Could you just talk about it in a minute or so?
So since the standards are designed in a way to meet a person's life with dignity, that's the core of the standards. So standards would remain same, but how do we approach and how do we ensure that the standards are met? Those strategies would need to be revisited, revised, and how to implement that, how to do programming in the times of COVID needs a rethinking. The existing toolkits, the existing guidelines need to be revisited at this moment in view of COVID.
Thank you. Thank you so much. I think we have one very pertinent question to which has come on the chat, and someone else has raised hand. One question that was to, I think, was to understanding how mobile creche in the last 3 months has done a function was one question which came earlier on. And would you like to take that, Sumitra? Would you like to help us understand a little bit in terms of intervention? Maybe you might also want to cover, or anyone else in the panel, this whole backlog of immunization. There is such a backlog of immunization in rural areas, how that might be covered, and are there any plans at the policy level?
Yeah, so very quickly, I'll take a minute to explain what Mobile Creches has done over the last 3 months. Just like many of us in the civil society sector, I mean, we had to very quickly adapt ourselves and respond to the emergency situation. One of the first things that we did was, of course, map all the households where we were in touch with in the communities where we were working, and start quickly having some kind of contact numbers, identify the community leaders in those areas so that we remain in touch when our centers and creches started shutting down middle of March. Then, of course, the entire month of April and May, the first response was the emergency relief response, which was around food and survival, and emergency health services. So a lot of relief distribution. I'm sure all of you have done it. uh, I'm not going to go about it in greater detail, but it was also the same time when we were tracking the pregnant and lactating mothers in our own communities, ensuring that they have access to their prenatal checkups or institutional deliveries and the immunizations. That was a big problem area, because transportation was shut down. There was police fear of going out on the road, so a lot of those things also limited families access to health services. um, and then of course during this time, talking to people, the ground realities, uh, started tracking the migration of how families were leaving construction sites and urban slums to go back into the villages, whether we are able to support them in this journey, whether we are able to track the families. All of that happened. But I think what was important was that mobile crushes, and just like cry also, I mean, we've been partners in a strong child rights advocacy network. We started auditing the ICDS services on the ground, starting with Delhi, as to even when the Supreme Court order was passed, I think around the 18th or 20th of May, that led to an MWCD order that THR must be supplied every 15 days. We started an ICDS audit on the ground from middle of April to see how many children were already lagging behind in their immunization, whether the nutrition was being provided on the ground, how many pregnant and lactating mothers in certain communities who were already facing delayed prenatal checkups, and giving these representations to ICDS department and state commissions for child protection. As a result of which, Delhi May, we started to activate some tracking system for immunization and prenatal checkup, and that then we slowly spoke to all our partners across the country to do similar exercises with their local state departments. काफ़ी काम एडवोकेसी के साथ और सिस्टम्स के साथ लिंक करके जो इमरजेंसी रिस्पॉन्स होना चाहिए वो हमने किया. ऑफ कोर्स सिस्टम्स के बाहर भी सिविल सोसाइटी का बहुत मैसिव इमरजेंसी रिलीफ रिस्पॉन्स था, उसके पार्ट हम रहे, बट सिस्टम्स के साथ जोड़ के काम करना बहुत ज़रूरी था इस दौरान, एंड दैट इज़ व्हाट आई एम फोकसिंग.
Yeah, I think that is really important for us to look at. That
because you can keep doing it privately, you will never be able to reach the breadth of the problem in this country. And as civil society, it is our responsible to stand with the government during this pandemic and support in the fight against COVID, but also raise questions from the ground so that you hold accountability and you make the system move a little bit when every focus was on this thing. Of course, 1 minute I'll take in terms of your reverse migration hua and people started going back to the villages. Even there, with our rural partners, we started talking to them that what about the young children who are coming back with their families? What's happening to them in the quarantine centers? What about their health, immunization, nutrition needs? As a result, I know that certainly in Odisha, MP, Jharkhand, and Chhattisgarh, we have now, our partners have now got orders from the state governments to do immunization tracking in the quarantine facilities. So if children are there staying for 14 days, then ICDS services and ASHA workers are visiting these quarantine services with all the safety protocols. At least order hai. Implementation में हमेशा gap होता है. But the point I'm trying to make is that the system linkages, whether in urban centers or rural centers, wherever the most vulnerable family is, include them within the system so that they get the host of services that we've all been talking about, the integrated needs of children and the multisectoral approach of the children. I'll stop here. I mean, there are lots of other things that we did in terms of training our childcare workers, creche workers to provide infant stimulation care. We redesigned our curriculum, Balwadi curriculum, to make it into a remote learning curriculum. Then if families did not have telephones or even what access to WhatsApp or even a simple phone, how did we form small bubble groups in the community with the community leader, and through them we provided the care and learning opportunities. So a lot of that has been done, and I'm happy that a lot of that has been done in a very process oriented way. There are documents, there are revised curriculums and modules, the whole capacity building about COVID prevention in relation to younger children. So a lot of that material is available. It's open source. Anybody who would like to use it, we would be happy to share that kind of material.
Right. Thank you, Sumitra, for this. I think there's a huge discussion on chat that I see on single parenting being vilified, and we also have a kind of question about around that. But I'm not quite sure where to whom I need to put this question. Would anyone in the panel like to respond to this question about, or maybe I can ask Aprajita if, in the whole, I know Suja said she's a single parent as well, but in from the perspective of, responsive parenting, Aprajita, how are we, it's being discussed in a way that, a single parent probably cannot or is not capable of providing, especially when it's a woman. So would you like to take that up, Rajita?
Difficult question. But then, okay, I don't know how to respond to this in a theoretical space, but as a mother myself, I would say that I'm not a single parent, but I feel that that if one is aware, and one realizes the importance of how our behavior or how our interaction today is going to change or will have an impact on my child. I think that is the important piece. If I'm not aware that today, if I'm irritated and I'm going to scold my child or maybe abuse my child at that time, and because I don't know what's going to hamper, is it going to hamper or not? Is it just going to discipline my child, or it will have a long lasting impact? So if I'm not aware, then I would be doing certain things unconsciously, because we have also been parented in a particular manner.
Absolutely. I think,
yeah. So if I'm aware and I understand and I see the difference, and so that is the thing. I mean, being a parent to a 4-year-old in a house where I have not been used to him staying for 24 hours, I also lose my patience. But at the end of the day, I need to go back and say that maybe I decided that I will never do certain things. These are my core principles, because I know the impact that it has. So
yeah. So I also think. Oh, sorry. Go ahead.
May I speak?
Yeah. Aparajita, you finished?
Yeah.
Okay. No, I was just adding. Yeah, Suja, I'll bring you in, but I think one issue that as psychologists we study is something called empty shell marriages. Though both the parents are there for a child, but whether that marriage, in which the institution of marriage or family, the social institution called family within which a child exists, is that really not toxic with both parents being there, or so I think the questions also lie somewhere there. Yes, Suja, go ahead.
Yeah. The thing is, as a single parent, I want to tell you that the best thing in my life when my child says that I want to be like you, and that is some of the best things I learned over a period of time, because I was very careful about all the actions and all the things which I did, because there is nobody else to look for and nobody else to blame if at all something goes wrong. And I had to take the role of a grandparents, mother, father, and also a care provider. And also I was working. And also at some point, now I can say that my child is 16 years and not that small. And it was very tough. It was really tough. And I traveled all around the place with my child as a backpack, and we lived a life very happily. And I have to say that it's something really good if you want to kind of enjoy the life, because irrespective of whether both of you are there. And for me, I was very sure that I will show only ethical things, because at the end of the day, if I go wrong, that will definitely reflect on her, my child, and there is nobody else to blame. And I think the journey was tough, but it's good and it's worth taking the trouble.
I think we'll close this here.
Can I
Who's
come?
that?
This is Sumitra here.
Yes, Sumitra, please.
Yeah, I
Yeah.
think, I mean, we are getting distracted into this whole discussion.
Yes,
Let's
yes. I
focus
know, I know.
young children, integrated rights, and let's not, and let's actually condemn this kind of distraction and very
Absolutely.
prejudiced distraction in a very serious panel discussion. I just want to bring back the attention to our focus on young children and their most marginalized families, and they're already going back. They've already been hit very badly. In terms of the health and nutrition, if we come back to focus on that, what as an action group, what we can do, two things that I'm thinking of as a suggestion here is that
Sumitra, can you just hold for 2 minutes? I'll come back to you. There is a
okay,
direct question on eggs for Mr. Daniel. So I'll just take that, and then
okay,
then your point will be more, you know,
sure,
we will need that point that you're
sure.
coming with. Yeah. Okay. So Dr. Daniel, I think early, right in the beginning after your presentation, someone was trying to ask, you know, how does one convince families to eat healthy food, and especially in they had written about, especially about eggs. So do you like to respond to that?
Yeah, the thing is that if you look at the dietary diversity, so at least for a child, out of the 7 food groups, I mean, they have to consume at least 4 food groups to ensure the dietary diversity. So, egg is one such food group. So that is, it means that egg itself is a food group. So it means that, so it's so very
I
important.
think I think the question was
Yeah,
question is about, was there resistance? Is it
yeah.
easy? Is it difficult? I think it's a little bit around that, around the sociology of that. Yeah.
Yeah, so yeah, there are like, so if some families, see, generally we are working with tribal areas and generally social class, low class people. So and we are not enforcing anybody like to have eggs, okay? And there are a lot of alternatives protein, like vegetable proteins are also available. So at least the family should have a protein rich diet, okay, so as a food group. So if those families who are ready to take egg as as an alternative protein to take, of course we
Mhm.
encourage, but we never
Yeah.
force, and we try to make them understand. But in some families, some children can eat eggs, but parents will not eat. So because they are concerned about child's growth. So I mean, we are not enforcing anybody. It's only like protein should be there in the food. That is the only thing which we require. So that dietary diversity is ensured. Yeah.
Right. Thank you. Thank you. Yes. Sumitra, I think while you also help us unpack the nutrition for 3 to 6 year old, I think there is also a question here on, disability of children who need might need a different kind of support. And, you know, you might want to highlight a little bit on that as well. Thank you.
Yeah, so quickly, immunization and nutrition. If I look at the backlog already that is created by the delay in the immunization schedule, what can we do to cover up and to reach children faster? Um, I, I mean, one strong recommendation is for the ICDS services to restart and to be recognized as essential services. I'm very aware of the statement I'm making when I'm saying restart the ICDS services or the Anganwadi centers, but focusing that the growth monitoring, the immunization, and the take-home ration, the nutrition council has to be started immediately. And if we mean immunization within the Anganwadi centers with time, with physical distance, those things can be started immediately. I'm not suggesting immediately to have children in groups for ECCE learning the 3 to 6 hours, but I'm definitely suggesting that one hot cooked meal was important for children in the Anganwadi centers, as it was important for school going children in the midday meal scheme also, which has now stopped. Just like government is providing large scale community kitchens, maintaining safe distance and protocols, why can we not restart the hot cooked meals in the Anganwadi centers and even in the schools to provide that one meal a day to children, so that that bit of nutrition is also covered? Of course, there are implementation gaps in terms of the delivery of THR, till the hot cooked meal is provided, then at least sufficient and timely quantities of the provisions that is required for the children should be given to the children as a part of the dry food provision.
So has mobile crash kind of outlined this kind of policy recommendations or recommendations that you might want to share?
Yeah,
Yeah,
I can
yeah,
share recommendations with the ICDS, recommendations of how to integrate the the food provisions within the PDS provisions or the midday meal provisions, and
right.
also recommendations under Manrega as to how to give more employment to women as supplementary support to the ICDS system to cover the backup load for immunization and growth monitoring, and also to help in the cooking and feeding with all the safety measures. This can be Manrega job card holder women who can do this as a part of the ICDS services during this time. So these are
Right.
all written down, documented recommendations, and I'm happy to share with the group, and request that all of you also at your levels push it forward. But remember, we can keep talking in Delhi. This has to go down to the district administration level and to the panchayat level. The strengthening of the PRI institution, the dialogue with the Gram Sabhas, the CDPOs at the district level, and the Anganwadi workers and the SMCs, the ASMCs is important, because they will become the community watchdogs. They have the capacity to ensure that these things are happening on the ground level. What was the other questions you asked me about government?
Differently abled children
Yeah, of
and their
course.
nutrition needs. Yeah,
Um, not just nutrition; it's everything. I mean,
yeah,
we know that
yes,
it's extreme vulnerability is intersection of vulnerability, young age, pandemic, and a child with disability at home, and that increased pressure on the family and the child being completely excluded. Uh, ICDS system is not talking about children with disabilities. Children with disabilities are further invisible. Only yesterday, I was speaking to a colleague in Delhi who said that they have called up families of around 1,000 Anganwadi centers in Delhi, and they have already mapped 100 children with disabilities under 8 years of age within these communities who are receiving no special support. So I don't want to make a big claim over here that we should do, क्योंकि ज्ञान बांटना easy है. The fact is that we are failing our children, and unless we come together and focus particularly on the special nutrition, therapeutic, emotional support for the child and for the family as a whole, then we are obviously not doing enough. It's not enough to talk about it. These children have already suffered because they're not assessed on time, they don't receive proper diagnosis on time, parents don't
yeah,
receive the proper support. At least ये एक मौका है जो हमको ये सिखा दिया कि फिजिकली हम पहुंच नहीं पा रहे, इसलिए सर्विसेज नहीं दे पा रहे, वो एक बहाना और हमारे पास नहीं है. रिमोटली अगर हम इतना काम कर सकते हैं, then why haven't we reached those disabled children or those tribal children who remain excluded from our system? This should teach us that there is a possibility to reach every child, and as the SDGs say, leave no one behind. If there's one thing that's come out good of this pandemic, the visibility of migrant workers and their living conditions and the denial of their rights, which we must move for better advocacy, and the fact that technology and all other systems, administrative systems, have enabled us to reach the farthest corner जहाँ लगता नहीं था लास्ट वीक ऑफ मार्च में कि वहाँ हम कैसे पहुंचेंगे, काम कैसे होगा, वहाँ हम पहुंच के काम कर रहे हैं ना, तो marginalized group
absolutely.
तक भी
All of us are doing that.
absolutely.
Yes. Tara ma'am is back with us. Dr. Tara, we would really like to hear from you, though we have about 8 minutes left for the session to end. So would you like to, take us through the presentation?
Tara ma'am, are we audible to you? Ma'am, please unmute yourself and speak once.
Yes.
Yes, ma'am.
Would you like us to, would you take us through the presentation? We have some time left with us.
We have about 7 minutes, Tara ma'am. We'd like to hear from you.
I don't think so. Her connection is strong.
Yeah, yeah, yeah. A
So,
very, I
Tara
think,
ma'am, the PPTs will be available on our Code Academy website. All the presentations will be available, including Tara ma'am. So if there is any specific questions, we'll take it. I'll announce it in the end. So for now, it's unfortunate that her connection is really unstable and we can't
yeah.
speak.
Yeah, I think there is another question on chat, which is a very interesting question. That is the last one we'll take. And that, I mean, it's also like a comment that Anganwadi workers are not getting safety equipments for the services. And yes, I mean, that is a reality that the ANMs, the Anganwadi workers, or the Ashas even are forced to go out and, work without safety equipment. So we at CRY have been at it and distributing masks and sanitizers um, during the last 3 months. And interestingly, we've also given some of the stuff to the police, and the police, Bombay police has been, it's been very effective that we've been able to do that along with the nutrition and the food that we have provided. So yes, I think it is important for all of us to see uh, that going ahead, how do we do education around the idea of COVID, and uh, and how do we, like, the simple education of wearing a mask. To my mind, it should have been the largest hoardings in the cities and towns and everywhere, and we don't have that. So I think public education from a public health point of view for children, for their parents, for the significant others would be something that is really important. And I'm glad that we're talking about the Anganwadi workers, Ashas and ANMs right at the end, but we are still talking. They are our frontline warriors. Um, Thank you so much, the panelists. It has been a really great discussion. And finally, we hope that our children, the tiniest ones in the cohort, are visible enough. We make that efforts together. So um, thank you all. Thanks a lot. I hand over to Navila now.
Thank you,
Navila, over to
Satyashri, for
you.
your moderation and keeping us all close to the time also. Thank you.
My pleasure.
Thank you, Satyashri. Actually, we haven't taken any live questions, so I'll take one live question, which will be the last one. So I'm just unmuting you, Mr. Anthony, and you can ask your question.
Sorry. I want to, hello, can you hear me?
Yes, sir, we can hear you.
I want to make a quick recall of the clearance of the pending backlog of routine immunization experimentation done in Madhya Pradesh and Bihar. There was a webinar in which they showed how they made use of the closed schools for adequate physical distancing and a staggered way of backlog clearance by each parent is called with the child and given the routine immunization. Second point I want to make is I see this opportunity as an opportunity for the young child less than 2 years on the care and stimulation by both the parents and all family members. Earlier, it used to be a crush worker or an Anganwadi center. There, the Anganwadi worker were giving some sort of a care for the under 3 children. Though it is Anganwadi centers are primarily for preschool education, but young children are also cared by some Anganwadi workers. But they need to be told and trained on the care and stimulation by audio, auditory stimulation, visual stimulation, touch, rocking, proprioception, singing. All those things can be taught to the mothers who are not going to work, and parents are also not going to the work, both the man, father and the mother. So this is a very opportunistic occasion when they can use the modern new immunization card in which skills and social skills and communication skills are assessed and each child corrected accordingly. So it needs little coaching and a one-to-one coaching to the concerned parents. And it is not a big workload. I mean, in an Anganwadi area, maybe 2 or 3 maximum under 2 kids will be there. So it's 2 family visits, which is doable and manageable. They can see the examples of Fulwari scheme in Chhattisgarh and in part of Kionjar, other Orissa also, some places where this Fulvaria under the community owned and managed under 2 care and stimulation centers, that can be replicated and looked at even now. Thank you.
Thank you so much, sir. Thank you so much for the information. I'll just do the last bit of announcement. Thank you everyone for attending the session. All the participants who attended the session with us, they can get their certificate of participation by visiting our website, which is www.sphereindiacovid19academy.org after 24 hours. You can also access all the presentation of the speakers there on the website, on the same website. Tomorrow, we have a very important session, which is role of sanitation workers during COVID-19, which is from 3:30 to 5:30 p.m. I look forward to the participation there as well. Links will be sent to your email IDs. Also, you can go through our website and register for the session. If you have any queries and we have not been able to take it, or any doubts, you can write to us at covid19academy@sphereindia.org.in, and we'll try to respond to all your queries. With this, I would like to thank all my panelists for the session. Thank you for this very, very enriching discussion on a very important topic. And thank you, the moderator, for moderating it so well and keeping us all in time. So thank you, everyone. Have a great evening. Bye-bye, all.
Thanks, Sateshri ji.
Bye.